How many doctors do you know that say that they want to be put out of business, right? And when I started Blue Fairy over 20 years ago, all the founding directors agreed that our goal was to one day no longer be needed. Like that was the goal for Blue Fairy long term. Like we don't want to be here. We don't want liver cancer to be a problem anymore. So I couldn't agree more with Dr. Singal. And he touched a lot, and so did Dr. Rich, on advocacy. Please stick around in the afternoon because we are going to talk about practical ways to advocate for yourself. And I just want to give one example before we dive into our discussion. 3 years ago, I went to see my PCP, the one who calls me the Hollow Woman, and he really is truly fantastic. But I said, something is wrong with me, and I am losing weight without trying. I've lost muscle mass, and I look like a walking skeleton. And my weight was down in the double digits, which was unheard of for me. And he kind of dismissed me initially, and I think it's because I'm not morbidly obese. I don't have high blood pressure. I don't have so many of the issues as other patients have where I live in Birmingham, Alabama. Very similar issues as in Dallas. And I finally said, okay, if this keeps up, I'm coming back. So I came back a month later, and I looked even worse. And my cheekbones, could cut glass. It was really bad. And he finally took me seriously and went, okay, let's do some advanced testing. I ended up having long COVID. I ended up having, I have some kind of gene that doesn't break down blood clots, which was terrible because I had micro blood clots all through my lungs, looked like spider webs. I'm really happy to say that I recovered. It was a long, hard recovery, but I was not going to give up until I got better. So there really is a part of the onus shouldn't be on the patient and families, but you really have to stand up for yourself. So we are going to have a quick discussion about if you have questions about screening for liver cancer, causes of liver cancer. We have Chastity in the back. She has a microphone. So raise your hand if you have a question for Dr. Singal and Dr. Rich. This is an incredible opportunity. And I'm going to kick it off with a story because I love stories. What would you guys do in this situation? So when I was about to get my gallbladder removed in the pre-op area, it was this communal pre-op. It was very strange. And I heard this young woman, I had seen her come in. She was a good 10, 15 years younger than me. And she was overweight, but not significantly, but overweight. And she said, hey, what happened to that thing with my liver, that scan you did? And her GI, who was not my GI, said, oh, you have fatty liver. Don't worry about it. You're fine. And if I had not had such a migraine from no caffeine and no water into going into pre-op, I would have gone over there and told her to fire him immediately. So from your perspective, what do you do and we're seeing it younger populations who have fatty liver, but they're told not to worry about it?
This work? Okay. Yeah, I would say that I think what you're describing is pretty common, especially with primary care doctors. I think in medical school, really, it wasn't a huge focus, liver disease in general. And I think this recognition that fatty liver, now called MASL, is much more prevalent and much more concerning and can progress than I think that we were ever taught, even back in medical school. But I think, as Dr. Singal was mentioning, as many as 1 in 3 people in the U.S. have some degree of fatty liver. I do think that, there was this perception that in some people it is not severe. In some people, they will not ever have any problems from fatty liver, just like they have fat anywhere else in their body. They may have some fat in the liver and they may not have any complications. But we do know that a subset of those, about 20% of those people, will go on to develop some inflammation, which can lead to scarring and cirrhosis. So the trick is figuring out who is which. And to your point, I think this idea of dismissing, a patient just when they find out they have fat on the liver, which is a common finding, is not the right thing to do. So definitely in that scenario, I would say, we need to do what we would call kind of risk stratify the patient, or we would want to see what is your risk of having any scarring in the future, and also do you have any evidence of scarring right now? And we have non-invasive tests to do that, meaning we don't need to do a biopsy or take a piece of the liver. We are able to do scans or blood tests, things like an ultrasound, that can tell us, do you have any evidence that that fat in the liver has caused some scarring or early cirrhosis even? So I agree with you. I wouldn't dismiss it at all, but I'm also a hepatologist. I'm biased. But I think the other complicating factor is because it's so common, not everyone will have a hepatologist or a GI, and that this is falling more and more in the purview of primary care doctors. So I think part of that is on us, that we're trying to educate our colleagues as well in the primary care field. But I think this, again, highlights the area where the patients really need to be their best advocates, and that's why we're trying to kind of educate patients as well. But definitely not benign, everyone. I don't know what you'd add to that.
Yeah. So, it's interesting. So, the way that I think about medicine is that we are trying to identify sort of quote unquote normal and abnormal, right? But normal is defined by population averages, right? And so the issue is that as this becomes more common, it becomes sort of everyday, right? So like when this doctor's like, you have fatty liver disease, don't worry about it. It's because quote unquote everyone has fatty liver disease. And so I think it just becomes this idea of like you become sort of, you tune it out, right? Because everyone has it. And I think it's problematic. I completely agree with Dr. Rich. It's become problematic that because it's so common, people don't actually pay much attention to it. I think I don't know the solution. I will say that even when you take a look at liver tests, it's fascinating to me because liver tests, when you take a look at an AST and an ALT, truly normal values are in the 20s, the teens or 20s. But what they've done as America has become sort of more obese, there's more chronic liver disease that is as fatty liver has sort of become more common, and you take a look at the normal range now goes up to the 30s/40s. So like what you've done is normal has started to include abnormal. Right. And it's just because they don't want everyone to be flagged as having abnormal liver tests. And so there's a little bit of an issue here. And I don't know, once again, what the solution is. But I would say this, like to your exact question here, what I would say is like, I agree with Dr. Rich. That patient does need an evaluation. We have non-invasive tests. Those non-invasive tests can include something called a transient elastography, also sort of brand name known as FibroScan. But what it does is not only tell you how much fat there is in the liver, but if there's any scar tissue laid down in the liver. And this allows you to say like, okay, is this just, quote unquote, just fat laid down in the liver, or is there being damage and chronic inflammation and scar tissue? Now, it's not just a one-time assessment, because just if somebody doesn't have scar tissue at one point, they should have continue to be followed and they can be reassessed down the road because they can develop scar tissue in the future. But I think that would be a simple test that we can do on that patient to see if this patient has damage or not. There's also tests that you can do from your blood tests that can also give you some sense of this. But I think the key thing is not just to blow it off, but there should be some assessment of, is this sort of simple fat, or is this something that's causing damage and this patient needs to sort of be evaluated? The final thing that I'd say is like independent of that, like I would argue the sort of conditions that cause this MASLD or fatty liver disease are obesity, diabetes, etc. And I don't care, honestly, if somebody has sort of not worrisome liver disease or not. At the end of the day, like that doctor should have said, you have fatty liver disease. And even if I don't, maybe the doctor had some information and it's not progressing, etc., the doctor should have taken that as an opportunity of saying, you have fatty liver disease. You really need to work on diet and exercise to have a healthier lifestyle. Because we know that fatty liver disease, it's not just about your liver. Those same conditions cause cardiovascular disease. Those same conditions, obesity, increases the risk of other cancers. So we know that these risk factors increase your risk of dying. And that was an opportunity, I would argue, to use, even if the doctor thought it was a benign condition, to reinforce, get out there and do your 10,000 steps. Stop eating, candy for dinner. Like you get the idea. Like, you know what I mean? Like it's the type of thing where eat a healthier diet. Start walking. start exercising. These are things that like we need to take every opportunity to educate and to sort of intervene, because it takes 10 attempts to change somebody's diet. It's so hard to exercise. Like, I mean, like, I myself am not good at, I make myself sound terrible. I'm overdue for my like doctor, like my dentist visit. I need to do my steps, but I mean, like, it's the type of thing where at least I had coffee. But so like, I think it's the type of thing where like, we need to take all these educational efforts in terms of steps, exercise, diet.
Do we have any questions from the audience? Don't be shy. Okay, so Chassie, would you, raise your hand, guys, so she can give you the mic, and so you can ask Dr. Rich and Dr. Singal a question. Thank you.
Hi, good afternoon. Can y'all hear me? Okay, my name is Robin, and I was diagnosed about a year ago with fatty liver disease. I was having a lot of pain in my lower abdomen, so I went to the hospital, and they told me that's what it was, non-alcoholic fatty liver disease. My doctor, however, did not, they sent the results to her and everything, but she did not even recognize it or say anything to me about it. So I'm saying, I guess my question is there hope or is there medication that I should be taking right now for fatty liver disease to help it go away or whatever? I don't really know. Yeah.
Thank you.
Yeah, so I'm really glad that they found it for you. And I just, before I get into your question, I just want to piggyback off of the last thing that was said, was particularly with people who have diabetes. If you have diabetes, or if a family member or friend has diabetes, I think that those people are at much higher risk of having not only fatty liver, but 80% or so of the cases of severe fatty liver are in people with diabetes. So particularly the risk of having more scarring or cirrhosis is more commonly going to happen in diabetics, which we all know diabetics in our family and friends. So in your case, you're right in that, again, I think this speaks to the fact that there was a little bit maybe of gap in knowledge of doctors even for a long time about this condition. And part of that was because for many years we had no treatments for fatty liver for many, many years. It was diet, exercise, kind of these lifestyle modifications that Dr. Singal was mentioning. But we've all heard that, right? For, if you have diabetes, you've already been told that, right? You've already, but now, fortunately, we have new medications that are both in the pipeline of research, and most recently that have one that has been FDA approved for the treatment of fatty liver, and there are many, many more on the way. Further, some of the GLP-1 medicines, the Ozempic, Wegovy, all of these, those are also being shown in trials to, independent of weight loss. So not just the fact that they help you lose weight to help the fat go out of the liver, but even in people who are leaner, can help treat fatty liver and reduce scarring, and even in some cases reverse scarring. So that is all very new, kind of on the horizon in the last 1 year or so. There's a medication called resmetirom, which was the first medicine that was FDA approved for fatty liver ever, that I'm aware of. So I think, so a lot of doctors are learning about these medicines. A lot of them are not widely available where you can just go pick them up at the pharmacy. But this is what's coming now. So I think the best advice I would have is to definitely ask to see a specialist. And the first kind of thing you would need before you would get started on one of these medications is this, what we call fibrosis assessment, which would to see how advanced is the fatty liver. Do you have any scarring? Have you already developed cirrhosis? Because that would be kind of what determines your candidacy for one of these medicines. Is it too early where you don't need it just yet? Or is it where you already have scarring and cirrhosis where it may not help you at this point and you may need something different? So that's what my recommendation would be. But I think you bring up a great point in that there is hope for fatty liver, where we had many years where there really was not much we could recommend. I don't know if maybe you have.
Yeah. I mean, so I just want to put the caveat out there just to be explicit about this, is like, we can't give individual recommendations. Like, we don't know your medical. So I just want to make sure, like, we're not saying you should get started on one of these medications, like just sort of like a sort of caveat on this. But I agree with everything that Dr. Rich said. I will tell you my personal perspective is, like, I truly reinforce the importance of diet and exercise. And I think those lifestyle interventions, even though we have pharmacotherapy that is now coming around, those lifestyle interventions are by far the most important. And, I think it's not just like sometimes I'll see patients, they're like, oh no, I changed what I'm eating. But then I ask, how much are you eating? And they're still eating sort of like way too much. So it's like, it's quantity control as well as the quality of your food. And it's not just food, it's the drinks. Like, I mean, honestly, like I remember like seeing one patient who like did a great job of control of the food and then would have a gigantic big gulp of like Coke that they would have like twice a day, and understanding like that. I mean, like we all, like, but big gulps of Coke have probably about, between two of them have about 700 calories. Like you can drink a lot of calories.
That's why there's no soda, guys. You can blame me. There's no soda.
So I think those are the other things, but I think diet and exercise are the base. Like that's critical. And these pharmacotherapies can be helpful. So Dr. Rich mentioned resmetirom, which is like a liver-specific agent that can help with fatty liver disease. I personally, I think resmetirom is a great medication, but I think of this as a systemic disease, diabetes, obesity, and it not only impacts your liver, impacts your heart, impacts other organs. So I'm much more enthusiastic about the systemic control of this, and the GLP-1s are a great sort of class of medication that can go into this, but they're expensive. They're not well covered by insurance right now. We don't, in my assessment, don't know the long-term consequences of being on these for years. So I that's why I'm such a big fan of like diet and exercise, because diet and exercise I know are helpful in many, many ways. And they have been around for decades and centuries, and we know that there are no like sort of harms in those. So like I think that's where I'm a big fan of reinforcing doing that if and when possible.
The other thing I would just add, if any of you are on GLP-1s or have taken GLP-1s, we have seen many patients on these where their fatty liver has improved/resolved on those medications. So that is worthwhile. If you've had elevated liver enzymes in the past, you lose some weight on a GLP-1, it would be very worthwhile to get your labs rechecked or have your fatty liver reassessed with the FibroScan or a blood test.
The one thing we can recommend specifically to you is if you haven't seen a hepatologist, I would recommend seeing a hepatologist just to once again to get this this assessment of how much damage has been done in your liver, and then discuss the treatment options in your individual case. A liver doctor,
Hepatologist.
yeah. And not to advertise UT, but we're happy to sort of like, if you want to be seen at UT, our liver clinic's fantastic.
Last question, and then we are going to move on to session 2.
Good morning, everyone. Just you all's opinion. They're promoting this dose. Is it? I think it's a smoothie. I'm not sure of what it is. It's like the next thing best to pound cake and vanilla ice cream as far as detox of the liver. Like they're promoting those theatrical diabetic commercials. Just wanted to get you all's opinion on it because I strongly considered trying it because, I mean.
Are you talking about the commercials that look like Broadway shows?
Right.
Yeah, I scream when I see those commercials. But,
right,
yes.
but they're now promoting the dose. It's a liver detox, and it's supposed to be the best thing since, I don't know. So just get your all's opinion on that.
I don't know which one you're specifically referencing. I don't know if I've seen this specific commercial, but I'll say my general sort of view on liver detox agents. The many, if not all, liver detox agents have not been vetted by the FDA. They're sort of herbal medications, meaning that they don't actually have regulatory agencies overseeing them. Many of those liver detox agents have no data to actually support any kind of benefit. Some of those liver detox agents are known to cause acute liver failure, so they can actually like cause you to die from liver disease. And the issue is because there's no one overseeing them, there have been actual cases where a company is known to cause acute liver failure from a liver detox agent, and then they get prosecuted, and all they do is they just close down shop, they declare bankruptcy, and they open up under a new name, and there's no one that can actually do anything about this because there's no agency overseeing all the herbal aid. The other thing is that because there's no agency overseeing them, what is in every bottle can slightly differ. So like in contrast to something that is FDA regulated, there's quality control. So every bottle within reason has to have the same exact composition. You go to the back and they can actually tell you exactly how much of every compound is in that sort of medication. For the herbal, there is no sort of like, once again, difference. It's like, I'm going to toss a little bit of this, a little bit of that, and then like I make my herbal and like the next bottle may be slightly different. So there's a lot of batch effects. So I would argue that outside of, once again, I can't give you personal advice. You should talk to your doctor about the specific agent. but my general view on herbals is highly negative.
He's not the slightest bit passionate about it at all, right? This is actually a quiz I give new employees after they've been with us a while about detoxification of your liver. And your liver is your body's detoxification system. Like, that's your liver's job. So I'm with you.